a photo of an elderly COVID-19 patient in a hospital bed watching the evening glow with his doctor in Wuhan of central China's Hubei province spread rapidly online. The kindness behind the doctor's care for the elderly sparked over 1 million discussions on social media. More than 2,000 years ago, Mencius, one of the Confucian classics, first told people to treat your elders as elders and extend it to the elders of others. Treat your young ones as young ones and extend it to the young ones of others. The concept remains deeply rooted in Chinese culture to this day. And in the battle against COVID-19, China has cherished all lives and not given up on one patient. Aided by the devotion of medical staff, Wuhan cleared all severe COVID-19 cases on April 24th. That day, a 90-year-old patient tested negative after being hospitalized for nearly 3 months. As a medical team from Shanghai prepared to go home after completing their aid mission in Wuhan, the sunset-watching patient is about to recover. The 87-year-old music professor played the violin for the team to express his appreciation. WHO Director General Tedros Adhanom Ghebreyesus once wrote on social media, quote, "Health workers are bearing the biggest burden in the COVID-19 outbreak," end quote. In the post, he shared a video story. In East China's Anhui province, 2 kids were left unattended after their parents contracted the coronavirus and were hospitalized. 6 nurses at an isolation facility offered to serve as stand-in parents, feeding and bathing the children and washing their clothes. Solidarity has helped China fight back against the virus without giving up on one patient. But on the other side of the Pacific, there have been heartbreaking stories. "Alexa, help me. I'm in pain. I have to find a way to relieve it. Can you help me cope with pain?" A 66-year-old nursing home resident who tested positive for coronavirus asked for help from virtual assistant Alexa to cope with her pain at least 40 times in the days before she died in Michigan in the US. According to the New York Times, some states in the US have made nursing homes accept COVID-19 patients from hospitals. In such shared facilities, elderly residents and workers live in a confined environment, facing a higher risk of infection. And in some European countries, the elderly have even faced life or death choices, with healthcare systems on the brink of collapse amid a surge of COVID-19 cases. Maybe what Kui Tiankai, Chinese ambassador to the US, said about China's approach to fighting the coronavirus is the key that has drawn many foreigners' envy and admiration. Quote, "Making people's lives and health the priority," end quote, is not only the basic rules China has kept during the pandemic, but is the one that reflects the deeply ingrained tradition of respecting the seniors and taking care of the children.